Peter Holmes, orthopedic surgeon, and I am host of your program, Ask a Doctor. This morning I have three guests, all part of a kidney care coordination team, led by Dr. Larry Davis, who's a nephrologist or kidney specialist, Veronica Garza, and Frank Boris, and we'll talk to all three. If you have any questions in the future for these, give us a holler two ways, either through my foundation at needfoundation.org or fax 696-9012. I'd like to talk about patient empowerment. In other words, what's best for your health may not be occurring, and what may be occurring is what's best for the bottom line, and you need to understand where that bottom line is. See, there's basically three ways that I can see that a physician makes money. Now, these three ways are fee-for-service, what we're going to call capitation, or as my dad used to call decapitation, and straight salary. So let's go into what you're all thinking how every doctor's paid, which is fee-for-service. Now, fee-for-service is much like you deal with your plumber, okay? If you have a plumber come to your house and he fixes your commode, you pay him for his service. That's a fee-for-service. Same thing as when a mechanic at the auto shop or carpenter, fee-for-service. Well, orthopedists aren't much different than carpenters other than the fact that skin gets in the way. And so if I'm a fee-for-service carpenter, basically, if you come in and I do your knee replacement, I move the skin out of the way, do my carpentry, put it back together, and charge a fee for my service. Now, with fee-for-service, obviously, the way to look at it is if a doctor doesn't recommend a treatment or recommend a surgery, perhaps you really don't need that treatment or surgery because he'd be making money by wanting to do it. Now, if the fee-for-service doctor does want to do the surgery, then you have to question, do I really need that surgery, or do I need a second opinion? So this is what people are used to. Well, maybe I'll get a second opinion or that kind of thing. So all of a sudden, let's swing around something called capitation or decapitation. If you have fee-for-service in your head, you're going to get hit by capitation. And this is sort of how it works. Depending on the contract, doctors are paid up front to take care of patients. And what's left over at the end of the year is what the doctor brings home for salary. Sort of just the opposite. Sort of makes the doctor sort of the insurance company. So I'm going to give you some round figures for this area. See, the federal government pays about $6,000 a year for the average Medicare patient. So they want to save money. So what they'll do is find somebody to take care of a bunch of Medicare patients for $5,500 each a year. So if a clinic signs up some 30,000 patients and gets $5,500, that clinic receives $165 million with an M from the federal government up front. Now, this is what they get, $165 million. So what's left at the end of the year is the profit for that clinic. If there's nothing left, they bring nothing home. So depending on their contract and the risk that they have, if that clinic refers a patient out to have, to say, dialysis or knee replacement or the like, it's going to come out of the pocket or out of that $165,000. So to refer a patient in that system to have a total knee is going to cost some dollars. Wonder which way it's going to go. At any rate, case in point, yesterday I was just talking to a doctor who had to operate on a patient's tumor in their thigh. They have a mass in their thigh. He thinks it may be a lipoma, which is a fat tumor. It's probably benign. But who knows? He wanted an MRI. That capitated system said no. He said, well, how about a CT scan? Capitated system, the cost of the MRI and the CT would come out of their system. So he's going to go just in and operate on this leg, on the mass, and hope it's simply a lipoma and not fibrosarcoma, which is about a 1% to 2% chance. The third way doctors get paid, or systems get paid, is simply salary. Now, if you get paid the same amount if you do 1 total knee a week or 8 total knees a week, how many total knees will get done? So I ran into this system a lot when I was in training and I was at the VA. It's simply how it worked. And I got in a lot of trouble at the VA for various reasons, but one of them I'll give you. Besides that, you never drive over an island at the VA if the gate doesn't go up. Anyway, so I'm at the VA and I'm not able to do 1 total joint a week. And I'm trying to figure out what's wrong here. Well, it turns out that you have to do the total joint, order the crutches come in 3 days later, person gets crutch trained, and then they go home. So I ordered the crutches the first day they came in. And then that way, they got their crutches, got crutch trained, had the surgery, and I was able to do 2 total joints a week. Seems like that would be the right thing to do. I got called down to the administrator's office. Dr. Holmes, you'll go back the old way. It's, quote, unsafe to do it that way. Well, it turns out the bottom line's this. In that system, they got paid per diem. In other words, if the beds were full, the VA got paid a set amount of money, period. That's the budget. If I did one total knee, I cost them one thing. If I did two, I doubled the cost in that system. Bottom line is, don't go over my budget. Therefore, you work from 7 to 4, and you go home, and you do the one joint. So let's have a pop quiz. You come into my office, and you have a cartilage tear in your knee because you just twisted it and can't straighten it, and I do the surgery tomorrow. Is that fee for service, capitation, or budget? Bam, time's up, fee for service. Case number 2, you fell down 3 months ago, get wheeled into my wheelchair because you haven't walked in 3 months. I finally get approval for an x-ray and find out you had a hip fracture for 3 months. It takes 2 weeks to get permission to do the hip replacement, and then once I do it, I get no rehab afterwards. Fee for service, capitation, or budget? Bam, she was capitated. Third case, patient needs a total knee, waits a year. Budget. Anyway, you need to know how your doctor is paid, know your disease, and know your options. These are my opinions. If you have any comments, there's 2 ways to reach me. You can reach me through my foundation at needfoundation.org or fax 696-9012 to ask the doctor.
Hi, I'm Danielle. I injured my knee back in February, but thanks to the foundation, I'll be playing again.
I'm Dr. Peter Holmes. The Orthopedic Need Foundation was formed to help those families who are underinsured or uninsured to return their athlete to their sport. Please help us to return kids back to their sport after injuries like this.
You can send your donations online at www.needfoundations.org or call 210-542-1722. All donations are tax deductible. Make a difference in a child's life.